This is Professor Michael Chapman. I'm one of the most experienced IVF doctors in Australia. I believe that an important part that I can contribute is to educate patients in relation to fertility, infertility, and all that involves. These series of podcasts help to educate you. I hope they are helpful to you. If you wish to know more, however, I'm more than happy to have you contact me via email, which is profmchapman@gmail.com, or make an appointment to see me on 9138 4222.
Prof, does life fertility offer payment options for people who have financial challenges?
Yeah, the cost of IVF is not cheap. On the other hand, relative to the potential future costs that you're going to have with a baby, it's actually quite small. And in Australia, we're incredibly lucky. We in the IVF world, the doctors in particular, have fought with government over many years to ensure that Medicare rebates are available for our patients, convincing government that not getting pregnant is a medical problem, not a social problem, means that these treatments are treated by Medicare the same way as an operation or seeing a doctor for medical problems. The costs involved for a single cycle in the premium services, and I'll talk later about what's premium and what's not. In the premium services, the cost range is in the order of, or has been in the order of 12 to 13,500 in some premium units, for which you get about a $5,500 rebate from Medicare. And then if you have private health insurance, that takes another $1,500 off your costs because your hospital fees are covered. At Life Fertility Sydney, we've attempted to economise compared with those other premium units, and our base rate is around $10,500, significantly lower than some of the other clinics. Those premium clinics, why are they called premium? Because they offer a full range of services. So that means genetic testing of embryos, it means donor sperm, donor eggs, it means having nursing staff available 7 days a week. It involves doctors undertaking the treatments in a way that maximises the chances of a pregnancy. So that's the premium service. I mean, I compare it, or people have, with business class versus Jetstar. Jetstar are what alleged to be bulk billed services. Those services, none of them are really bulk billed. There's still costs involved in those services, but they range from around about the 2,000 to 3,000 mark on top of the bulk bill, the 5,000, $5,500 I was talking about before. So they're in the sort of $6,000 to $8,000 range, with the rebate taking it back to or $3,000 out of pocket. Most of those clinics programming cycles, not necessarily providing 7-day-a-week service, and the way you can cut your costs is to reduce your backup staff. Our nurses are, as I said before, available all the time. So there is a difference in the quality of the service that you get. Their pregnancy rates are reported as good, but then they tend to be treating a different range of patients, the younger patients who can't afford the premium type services. In terms of life fertility, there's no packages because there's an upfront cost and then there's the rebates from the government, and that's what makes it affordable. At the moment in New South Wales, for instance, on top of that, if it's a first cycle, there's an extra $2,000 that the state government is providing on top of the Medicare. So, it's $2,000 or $3,000 out of pocket. It can be as low as that if you've got private healthcare. So, yeah, it's not cheap. On the other hand, when you look across the world, the United States, for instance, where one cycle can cost you the Australian equivalent of $20,000 to $25,000, we're actually very lucky to have that government support, and our costs are not the same as those expensive clinics. I was in the United Kingdom recently, and their costs, because they don't have Medicare, are almost double that which we have in Australia.
Prof, in terms of health insurance, do you have any recommendations as to what questions people should ask for their insurers, or things they should look out for before they undertake IVF?
Yeah. So most funds will cover IVF in their higher band rates. However, the question is, how long do you have to be in the fund before you can qualify to use those? And that's one of the issues that you should be asking your fund. Generally, it's 12 months. So, if you're planning to have an IVF cycle, you'd need to be in the fund for 12 months. Now, what difference does the fund make? As I've said earlier, the fund covers hospital costs. So your day surgery fees, $1,500, $1,600 would be covered by your private fund. But a part of the anaesthetic fees, if you have an anaesthetist involved in it, will be by the fund. But that's about it. So, in a cycle where you're paying with us $10,500 as the base price, you might make a small saving, but these days with health fund costs of $2,000 or $3,000 for a family, it's debatable whether you bother taking out insurance, because it's pretty much a trade-off. The other way of funding, which has become, I wouldn't call it popular, but a number of couples that I've looked after, or people that I've looked after, have turned to their super funds, and there are exemptions of being able to draw down your superannuation funds to assist in your fertility quest, mainly based around the psychological trauma of not being able to have a baby. And it's becoming a little bit tougher in that they're asking for psychological assessment in allowing you to access your super, but it's not impossible.
And don't forget that you can access all the previous episodes by going to our website www.theivfjourney.com and select IVF Journey podcast from the navigation menu.